Well, from the killings of Renee Good and Alex Preddy to the jarring images and the videos coming out of Operation Metro Surge in the Twin Cities, it's been a difficult stretch of headlines for Minnesotans of all ages, including kids, to say the least. And joining me now to discuss some of the impacts of what we are witnessing and how it's affecting children's mental health are two licensed marriage and family therapists with Change Inc., Anna Lewis and Adelinda Sanchez. Thank you both for being here this morning. First of all, for those who are unfamiliar with your organization, just give us an overview of Change Inc. and the resources that you all provide there.
Absolutely. So Change Inc. is a nonprofit agency here in the Twin Cities, and we have several different programs, one being mental health therapy. So we primarily do school-based mental health, so we work primarily with youth and their families in communities, especially communities that are impoverished or impacted by multiple stressors.
Wow, okay, so what are you seeing when you're working with some of these young people and the families in terms of what we're witnessing as these ICE operations continue?
Yeah, well, like COVID, when everyone was in the same boat, it was very clear that there was an impact for your children's mental health. But this is a little bit different, right? When we walk out the streets and we see a lot of scenes with violence, even just, I've had colleagues where their children have witnessed people being detained. A lot of the kids are starting to feel a lot of fear, right? And that fear can manifest in anything from mood changes and just behavior changes to the way that they're starting to frame the world. So, kids need us to make a sense of the world. And when that is the case, when we are also trying to make a sense of the world, they will be impacted. So we're seeing a lot of changes in even just learning. It's hard to learn when you're watching out the window, seeing what's going on, or watching your classmates cry or even missing.
And Anna, you were saying you're seeing a lot of emotions like fear and anxiety within families.
Yep, absolutely. Fear, anxiety, confusion, potentially at this point reaching levels of despair and hopelessness because it's been ongoing for so long. And kids really take their cues from the adults in their lives. And a lot of the adults in their lives are scared right now. And they're having trouble maintaining their daily routines, going to work, going to the store, sending their kids to school. And all that disruption in their routine really impacts kids.
Right, and I think it's especially tricky for adults who are trying to stay informed, right? But at the same time, it can be overwhelming because of the amount of news that's coming out. So what is some guidance or advice that you'd have for parents who are trying to have these conversations with their children right now?
Yeah, well, one thing that, I'm meeting with groups of teachers and caretakers and providers, we have to speak to the age of the child, right? Not to our logic. I know sometimes we want to say a lot of things and they don't need to know all the details. One helpful resource I have found is a book by Chandra Ghosh Ipin. It's called Once I Was Very Scared. It kind of helps for the adults to understand how fear can present in kids in different ways, and using that kind of language to really help them understand that things are scary. Just processing is helpful because even if we're not talking about things, kids are seeing things and hearing things from their friends, and they will fill in the gaps. Also, I know Change Inc. did a wonderful post on, how can parents speak to their kids about what's going on. There's a lot of resources. The Minnesota Association for Children's Mental Health also has trainings and things on their website, 0to3.org. There's a lot of resources out there. I know there's a couple of books circulating on how to talk to children about it.
Absolutely.
And I'm wondering how the adult in this scenario would also be able to prioritize their mental health while taking care of other people.
Yeah, and one of the values and missions of Change Inc. is we really highlight how relationships are the key to change and to connection and to feeling safety. And so I think really focusing in on community and relationships and building that strong foundation within yourself can be such a healing thing for your mental health. So I would recommend for sure that adults do that. And like Adelinda said, at this point kids know something's happening. The level of detail varies, but it's hard for adults. I think at this point what I wouldn't recommend is to ignore it or to invalidate children feeling afraid, even if the parents are feeling like, well, this isn't really impacting us. At this point it's pretty much impacting everyone across the state.
Wow, and like you've said, solidarity and community is very important, and just finding maybe something small that gives you hope, I'd imagine goes a long way.
Absolutely.
Yeah, there's a saying in Spanish, solo sufrimos, juntos sanamos. We suffer alone, but we heal together. Fear grows in isolation, and so does trauma. One of the most protective factors is relationships. Not only that, it's safety, safe relationships. So, you know, safety doesn't mean the absence of fear, it means the presence of connection. So even we might not know all the answers, we might not even know what to say, and calm might not be available to us right now. But if we could just be present there and just be with the child, listen, that's very significant.
Well said. All right. Thank you both for being here. I appreciate your insights and your expertise. If you'd like more information, we do have the websites listed right there on the bottom of your screen. But we're going to take a short break and we'll be right back.